Surgical care covers interventions which are critical for specific conditions in preventing premature deaths, disabilities, and accelerate good health. Professor Makasa stressed that SOA care is an indispensable part of quality health and a key component of strengthening universal health coverage in Africa. He explains that 30% of the global disease burdens are surgical and nearly 143 million procedures are needed annually to offset disease burdens and inequality. Makasa points out that public hospitals in African countries either do not provide proper SOA care, which leads patients to seek such services at private hospitals, which is very costly. This, he says, leads to premature deaths and disability, as well as pushes families into poverty as they have to borrow money to afford such services, which hinders economic development. If not addressed before 2030, Africa could lose 2% of its GDP. He believes that by improving the provision of proper SOA care in public hospitals, it will offer good and practical options in strengthening the health system at all levels in areas of prevention, treatment, and rehabilitation. At the same occasion, the Minister of Health and Social Services, Dr. Bernard Haufiku, says Namibia will continue to support the scaling up of strengthening health systems. Haufiku is hopeful that the upcoming SADC Ministers of Health meeting will come up with tangible health outcomes to enhance universal health coverage. The meeting was held under the theme Strengthening Emergency and Essential Surgical Care and Anesthesia as a Component of Primary Health Care and Universal Health Coverage towards Health for All in 2030. Juliana Fuka, NBC News, Bantuk.